Good to be here. Good morning, I believe it is. For those who do not yet know UN Habitat, UN Habitat is a United Nations Human Settlement Programs, the arm of the United Nations that deals with all type of human settlements, meaning that it tries to connect the social, economic, social and environment, really about people and space. So for the last 40 years, we have been working in all this type of settlement, though many of you might think that we are very much city-focused. It's not the case. Our mandate is really about the territory. So I just want to echo the discussion we had earlier on the issue of urban and rural. So my talk here will not be really about urban as you may have seen it. It's about where people live and the impact on their health. So even if you have 200 people, their health is still very important. So I have three messages. One is about what had been discussed earlier, that we believe in the issue of multiplicity. First, in terms of scale, that is important that even the health starts with us, goes to the household, moves to the city, moves to the nation, and when we talk about climate change, it becomes global. So that multi-scale dimension is very essential. Let's not just look at one scale. The second is, of course, have been discussed, the multi-stakeholder, which I will just mention that it's important that we talk about engagement rather than just participation. And on that one as well, instead of just talking about public-private partnership, I will add people there, that ultimately is about people. So it should be about public-private people partnership. The third message, which I believe is very important, is that we are living in a time where we have disruptive technology, disruptive knowledge. And here, what I will submit is that we either will intersect or we die. So that actually echo what the previous speakers have said, that if health actors and the urban actors are not working together, if you are not intersecting, you cannot really achieve much. So the more we intersect, the more we work together, it will be important. So on that note, what we have done so far, just to show our willingness and our readiness to engage in that global health campaign, is that we just signed an MOU about two weeks ago with the International Science Council, the Institute of Urban Environment, and the Chinese Academy of Science to look very much in that area of urban, territorial, and planning and health, just to show that we are really very much into that area. Some of these issues had already been discussed, urban areas or different territories have different implications on health. I will not go stretch on this, but I just want to maybe refer to two important global frameworks that you are already familiar with. The first one you heard at least 3 times already, the connection between within the SDGs with the goal 3 and 11. But what I just want to emphasize here is that all the Sustainable Development Goals are talking to each other. They complement each other. It's not just 1 and 2, but it's about all the 17 goals working as a system. On the new urban agenda and the work that we have done with WHO, where some of their contributions was actually putting health at the center of what the new urban agenda would be measured against. So if the new urban agenda could achieve in improving health or well-being, then we could maybe stand tall and claim that it has actually been a success. So this, you will know very much that many entries in the SDG 3 and 11, but what I just want to make the link here with what WHO has submitted, that is very important in when we are preparing the Habitat 3 and the outcome document, the new urban agenda, that health was really part of that discussion. And as a consequence, just show you the connections, how much reference the health dimension is reflected in the new urban agenda. Again, I will show you later that even in our strategic plan 2020-2025, we have captured all these elements in our engagement, just to say that UN Habitat is really trying to get back on that game, trying to engage very much with the professionals or actors in the health field. So the strategic plan, again, takes many of these dimensions. One is what Jenny just mentioned on public space, but really about the issue of resilience that was indicated earlier, the issue of clean air and so forth. So they are all part of our next 6-year engagement with member state and other actors to move into that direction. I would like maybe to just say a few words on our framing of this issue under the instrument that we have been using, the international guidelines on urban and territorial planning, where the health dimensions have been also reflected, not to the satisfaction of some colleagues in the health sector. Hence, our endeavor now to work with WHO. We are preparing a new guidance note on urban territorial planning and health, the implication on health. So that work is ongoing. So we have also developed a few cases. I will show you some example what is emerging in the area of urban and territorial intervention and the implication on health. We have also, as I indicated, the guidebook on planning and health that we are doing with WHO. We have also developed an assessment. I saw Mark with the assessment on tool that they have prepared on transport. We have done again on planning, urban territorial planning and health that we have been piloting in few places already. We also are really into the area of partnership, working with actors in the health sector. I think that might be announced at a certain point, but we took part in the last 2 international conference on urban health. And we are very much committed to be part of the next one that will take place in China in October. So just to give you a flavor of what is coming out from some of the evidence that we have been collecting, that when we try to look at the area of interventions where things can happen, it's not only about urban design, it's about the urban planning and territorial intervention. That's where the big issues are. I know that we have discussed the issue of, say, air quality, food and nutrition, the importance of greening and others on transport. But what we are finding is that planning has a major role to play to change the way in which a health outcome can be achieved. Now, what can be addressed? Ultimately, what are we looking at? Is really the well-being. So that's one of the areas where we are looking at after we have undertaken that review, that if our intervention in planning can contribute in improving well-being, this is where we're going to make an intervention. Just a bracket here to say, for the last 2 years, we worked with Uganda Academy of Science. We produced 2 important outcomes in the context of Africa. And there was one thing that struck me in that discussion, which was, you can say it's Africa focus or that region focus. They came up with what they call spiritual health, because they felt that the definition that we have now on physical, mental, and other are not capturing the importance of physical health that manifests itself in that context very importantly. So I just want to throw that this element of spiritual health is very important for the well-being of some of the people. So I just want to quickly introduce some of the instruments we have been using to see where the nexus are, where the intersections are, using what I indicated earlier, the dimension of multi-scale, multi-stakeholder engagement with the aim of bringing urban, if you call them urban and health professional, health actor together. So that's one of the purposes. And in cases where we have been working, this was one of the first time, a medical doctor is sitting in the room with an urban planner. But in the discussion, they say, oh, where have we been? So this is very important instrument for engaging different stakeholders and identifying juncture, areas of collaboration and opportunities, and start identifying different interventions that they will undertake together. So we have done this in 2 places, in Cameroon and in Uganda, and we are planning to do the same in Cape Town, I believe in October, November. So these are very important ways of engaging these 2 community of practice. We are also going to highlight 2 initiatives that we have at UN Habitat. One is on very much from the angle of resilience and climate change and the impact on health that we have been doing in collaboration with many partners, and the other looking at the impact of built environment and the intervention. We heard earlier the example of housing design, so we had similar experience in Africa where we tried to see how the different intervention at that scale could impact the health outcome. So we apply that in the case of the project we call Building Out Vector-Borne Disease in Sub-Saharan Africa. We apply on malaria and dengue intervention, where we could see the reduction in malaria infection and also dengue fever. Just to say that we have some resources that are trying to bring all these connections together. I will leave these presentations if it's okay. There are many cases that are put in appendix for those who might be interested in seeing some of the things we have been collecting to build our case to provide more normative guidance and developing our tools and interventions and working with partners in this particular important area of work. So thank you.